All right. Good morning, everybody. This is Carolina Sanchez. I'm the Global Director for Poverty and Equity at the World Bank, and it's a pleasure to welcome you all to this session with Professor Mushfiq on the trade-offs between health measures and economic measures and how developing countries should be thinking about these trade-offs. I'll say a few words of introduction and then introduce our speaker, and we'll get started. Data on the impacts, economic and social impacts of the COVID pandemic is still scarce, but the data that we have and our simulation models already suggest that these impacts, and particularly the poverty impacts of the shock, are likely to be quite significant. We are estimating that the pandemic will generate an additional 50 million extreme poor around the world. And although we know that many households will be affected by the shock almost immediately, we also predict that the impacts will be most severe and deepest in both poorer countries and for the poor and vulnerable. So of the 49 million that I talked about, 23 million will be in sub-Saharan Africa, an additional 16 million will be in South Asia, 17 million in IDA countries. This is not to say that there won't be impacts in middle-income countries, but as I said, they will be most felt in poor countries and among the poor. We also know, and this draws in from work from Professor Mushfiq and others, that these impacts are actually materializing very fast and much faster than they have done in previous crises, like, for example, the financial. So we already see households suffering significant employment and income losses, and in many cases, dealing with those by reducing the consumption of food and other necessities. And this is very worrisome, not just because it has immediate impacts on welfare, but because it may have devastating impacts on the long-term capacity of these households to overcome their poverty status. When we look around the world, what we see is that many developing countries are actually responding to this crisis following models that have been applied in the US, in Europe, and in other upper middle income countries, and that they are being only somewhat successful in doing so. And I think this raises then the question of whether developing countries should be thinking about the policy response in a slightly different ways, which is really what the topic of today's talk is. So in that context, it's really a pleasure to welcome Professor Mushfiq Mubarak to our seminar. He's going to share some results from work that he's doing on this precise topic with us, and I suspect that this will give us a lot for thought for a very lively conversation. He really requires no introduction in this setting. Many of us are very familiar with his work. He's a professor of economics at Yale University, where he has also founded the Yale Research Initiative on Innovation and Scale. He holds appointments, among others, at JPAL and IPA. And his research has touched upon many issues that are relevant in the context of developing economics, but he's explored ways to induce behavioral change in people that live in developing countries that can actually foster welfare improvements. And I know that he'll touch upon some of this today as well. And of course, he has an extensive publication record on these and other issues. So the way we'll go about this is we'll start with the presentation, and I think we have about 20-25 minutes for that. Then I'll ask Benu Bidani, who's the practice manager in the South Asia region for the Poverty and Equity Group, to come in with some comments and reactions to the presentation. And then we'll open the session up for Q&A, which I'm sure will be, as I said, quite active. We have a lot of people connected, so I'm going to suggest that we use the chat box to organize the Q&A and that everybody remains muted during the discussion. So what I'll do is I'll keep looking at the chat box, and I'll call upon you to ask your question, and then you unmute yourself and come in and ask it. But please, let's use the chat box, because otherwise I fear that we'll have a lot of people to unmute themselves and speak at the same time. Hopefully that will work. And without further ado, Professor, the floor is yours, and we are looking forward to hearing from you. Thanks.
Okay. Thank you, Carolina, for that very kind introduction. Thank you, Javier, for organizing this and suggesting it, and Ruby for helping with the logistics as well. And let me, from the outset, be clear about a couple of things. One is I should apologize already that we're all flying blind and we're kind of scrambling to come up with responses, both research as well as policy and implementation responses. I'm working with a lot of different actors in Bangladesh for their implementation capacity. And so a lot of the things I'm saying, which might not sound true to you or I'm unsure about still. So hopefully we'll have discussions about it. And the second reason I want to be clear why I'm doing this, even though we are very busy, is that I was excited to get the invitation because it's vitally important that we coordinate, right? That we connect and coordinate. And so I wrote back to Javier and requested that, especially if there are World Bank offices in Bangladesh, Nepal, Nigeria, other countries where we have been working or starting work, that I need to make those connections so that we don't replicate efforts and we complement each other's work as best as possible. So I'm hoping this is an invitation that please connect with me, and after the talk, we can coordinate better. Okay. Okay, so let me get started. So this idea that Carolina already introduced, which is that low-income countries and high-income countries are different and therefore may want to think differently about the appropriate response strategies, right? That's not a unique idea, new idea. Everybody's been writing about it. This is from The Economist, right? Where they point out that we have been in low-income countries, we have been following the lockdowns, and I think an unfortunate thing that happened here is that the virus, unlike say Ebola or Zika virus, etc., this hit rich countries first, right? And what that meant was that it immediately captured the international media's attention, and the international media has remained focused and captured by what's happening in Europe and the United States, and that's natural. That's what media always does. But that also means that a lot of the stories we're hearing, the strategies we're discussing, are the rich country strategies. And so we need to think carefully and take a step back and think, okay, look, should we be even subconsciously, are we just adopting what is happening in rich countries, or should we be thinking separately and differently about what we should do in low-income settings? Okay. And so I'll do the talk in two parts. I'll first talk about like a general argument I made about low-income countries, and I've gotten in a little bit of trouble for making this argument, but I will give you the logic that we have. So that's just overall how should high and low income countries think about things differently. And then I will try to reserve most of our time to be much more action oriented and tell you about the specific things that we've been doing in Bangladesh for the last 3 weeks. And here, while I'm representing a large, I'm here talking, I'm representing a very, very large team, right? So I have a slide towards the end with all the partners listed. There are large NGOs in Bangladesh like BRAC, new think tanks like BIGD, BRAC Institute of Governance and Development. They've been making lots of efforts collecting data. The government, of course, is heavily involved. We're connected with them, and to the extent possible, we're trying to integrate our efforts with the government's efforts, and we're trying to be responsive to every single thing that the government asks us to do. And then on the researcher side, there's many different researchers who are volunteering their time. I'll try to name some as we go along, but there are at least 30 people who are spending a lot of time on this. And then one of the things I've learned over the past 3 weeks, the most beautiful thing to come out of this is that there's an immense reservoir of talent in my country, in Bangladesh. Right? And we've been able to connect with computer scientists, with engineers, right, who are also making these efforts, and even marketing, advertising professionals, right, and people who work in the religious area, which has turned out to be very important for us. Right? It's just like these connections. I mean, the only silver lining is that this connection happened thanks to the crisis we're under. Okay, so let me start by making this argument about why low and high income countries should behave differently. So this is a graph of the population age distribution separated by the World Bank's classification of low, middle income, upper middle income, and upper income. Okay? So the first thing you notice is that the age distributions look very different. So the size of each bar is just a number of countries that have that as the percent of the population over age 65. The distributions look very different, and the bottom line number is that in high-income countries, you have about 18% of the population, which is above age of 65. In low-income countries, it's 3%. Right? And we also know from the medical side that this virus is much more dangerous and fatal for people who are old and not so much for the youth. Right? Which already suggests that any epidemiological model that you run, So let's take the very influential Imperial College model, right? The one that has influenced policy design in the US and UK, right? You take that model, you just change the numbers and you run the numbers for Bangladesh, India, Sub-Saharan Africa rather than US and UK, you get a very different answer, right? We have to recognize that. Like even if you follow the exact same decision-making strategy that the rich countries have followed, right? We have to allow for the fact that the answers are different, okay? And another thing that's not in the model that we also have to pay attention to is that the vulnerable population. So when social distancing also means economic distancing, right? Then we also have to think about who are the vulnerable population who might suffer most from economic distancing. And that distribution also looks very different in low-income countries, right? This is the percent, like this is just one data point, the percent of the workforce that's informally employed. Okay, so these are people who it might be much more difficult for us to reach with social benefit transfers, right? And so the cost that will have to be borne by, like say, day wage laborers in poor countries is going to be very different than if you're in a country that can pass social distancing guidelines and immediately be deep pocketed enough to send out huge benefit transfers. Right? So both the benefits and the costs, I think, are different when you think about low versus middle income. So now on the benefit side, when we run these numbers, this is what you get. So this is the mortality estimated by that Imperial College model, right? In high income countries, when you move from unmitigated to social distancing, right? First of all, the mortality rates are going to be very different because of the age structure of the population. And the second thing that you see in this graph, there are two things I want to point out. The one is that upper income, the numbers are much higher than in low income. The second thing is that when you move to social distancing, the number of lives you get to save in upper income is much higher than the number of lives you get to save in low income. Right? It's the slopes of these lines are very different. Okay? And so if you now translate this to dollar terms, right? Because now you also want to think about, like, given the benefits and the costs, how are people trading off like the disease risk against the risk of morbidity, mortality, etc., that might come from pressures on economic livelihood or taking their economic livelihood away, right? So once we start, incorporating that, through the VSL methodology, value statistical life methodology, which is essentially about the trade-off between, say, risk of disease versus my concerns about economic livelihood, right? Again, you get a very different sense. So first of all, the cost of the disease is much higher in the United States than it is in middle income, than it is in lower income countries, lower middle income countries. And the second thing is that the slopes are very different, right? The benefits of social distancing relative to not social distancing, right? This gap is different from what it is for Japan or the United States. That's another thing that you get out of the same exact model. So this is just like, where are these numbers coming from? I'm just taking the Imperial College model that people have been using already, and I'm just inserting some economics into it. That's all it is. Okay, and it's coming from, well, relatively older population in high-income countries. In developing countries, one difference is that workers are in the informal sector, higher levels of poverty, food insecurity. So then when there's economic distancing and people don't get access to livelihood for that week, right? For you and me, it doesn't matter. I'm sitting at home doing my job. Carolina, it looks like is sitting in her home and able to do her job, right? Whereas for a day wage laborer in Bangladesh, right, whose earnings for that day or for that week might determine what that family gets to eat that week, right? We have to think about the cost of imposing distancing on them differently. Okay? And let me skip over. Right? So the other thing I want to point out here is that it's important for us to think carefully about social protection measures. Okay. All right, so what do we have in mind on, what do we learn from this and how should we move forward, and like the decisions we're making on a day-to-day, hour-to-hour, week-to-week basis. So there are some cheap policies that we should be thinking harder about. Okay, so one, I would say my current feeling is, and again, as I said at the outset, I am uncertain about things, right? All of us are flying blind, and I'm updating as I learn every day. Okay? But my current thinking is that yes, we should be imposing social distancing everywhere, but in a sensible and nuanced way, right? So, for example, if somebody needs to go out for their economic livelihood in poor countries, right, you cannot impose countrywide lockdowns all at once. Right? That imposes a huge cost. Whereas if whereas like let's say gatherings or going out for purposes that are unrelated to economic livelihoods, we should really clamp down on that. So things like religious gatherings and social gatherings, we need to figure out ways to help people figure out how to do those things at home, right? Or uh, congregate in large groups. Um, and one other thing here that is really important that I've learned over the past several days, thinking about what exactly in practice is happening in Bangladesh, is that you need to, and in Nepal, you need to get social protection payments, regardless of what social distancing strategy you adopt, right? We need to get social protection payments in the hands of the poor very, very quickly, right? Every country needs to do that, and everybody is planning for this, but of course, it's easier said than done, right? You have fundamental problems about how to target the poor, how to identify them, and then how to send money to them, right? And different countries have different levels of infrastructure set up to solve those tasks. And we need to figure out how do we best attain this task, attain this goal in given the country's existing infrastructure, right? And then there's smaller things like increase in hand washing hygiene measures, right? We should be thinking about frugal innovations. And here again, the fact that the media attention and everything was focused on rich countries, I think really is hurting us in the sense that every day in the media we are hearing about, oh, this strategy or that strategy, but that's mostly coming from Europe, US, places like that. Right? Just because a strategy is sensible there, like in South Korea, we can use very sophisticated mobile-based tracking and do testing and isolation, right? Doesn't mean that that's the right strategy for Sierra Leone, right? Whereas we might actually have other poor countries may have a lot more to learn from Sierra Leone because they've had experience post Ebola crisis and they were able to respond to this crisis, the current crisis, in many ways much better than richer countries like Bangladesh, richer than Sierra Leone, like Bangladesh or Pakistan. Right? And Bangladesh, Pakistan, Indonesia actually have a lot to learn from them. So here's a simple example of this. So in Freetown in Sierra Leone, right, that's another place where I do research. Every single building, entering it, exiting it, you see Veronica buckets. So it's named after a woman named Veronica who's Ghanaian. It's a Ghanaian invention. This doesn't require running water. It's just bleach in the water plus a basin and washing, right? And everybody comes in and goes out. Every single person washes their hands. And this is not just Freetown. You go out to the remote rural areas at police checkpoints, you have Veronica buckets, right? In remote villages, you have Veronica buckets, right? We need to understand how to quickly deploy such frugal innovations. Similarly, another thing we learned from the experience of Sierra Leone, like when they were trying to spread the message about Ebola and its dangers, right? Immediately, the first thing they did was, okay, let's use the high quality information we have with the and so they sent out military vehicles to go and blast messages, right? And then given Sierra Leone's history, what we learned back then was that people were running away from military vehicles, given history of civil war, etc. Right? They weren't listening to the message. And then this time around, they immediately connected with local community leaders, religious leaders, right? And spread messages that way. And that seems to be working better. And we also need to figure out how to get local communities involved and endorsing our message so that people hear trusted messages from people that they find trustworthy. Yeah. Okay, so now let's think about. I want to now move on to what are the specific things we're doing in Bangladesh, in Nepal, and how that might be helpful, and where hopefully we can figure out ways to coordinate and collaborate. So as I started thinking about this problem about 3 weeks ago, the very first thing that occurred to me in designing our strategy is we cannot rely on testing-based policy responses. In the US, they're focusing on that, and we hear this in the media every day. The only way for us to open the economy is that we need to do sufficient number of testing. Now, that's not going to happen in Bangladesh in the immediate term or even in the medium term. Right? So in the absence of that, what can we do? How do we devise a strategy? What other type of data can we collect to make indirect inferences about what's going on around the country? Then the other thing that happened very quickly is that the very first week that I was thinking about this and connecting with Bangladesh, the concern was people aren't taking this seriously enough, right? The government announced something like a lockdown, except they used the word chuti for it, which means like vacation. And so people took, they seem to have taken it to mean that, oh, that's what this is. And so what I normally do is when there's a chuti, I leave the urban center, then I go out to my home district, right? And then immediately there are pictures a day later, thousands of people got on trains, packed together, right, and buses, and went back home, right? Possibly spreading the disease in the process. And so then that was the issue in the first week. And then the second week, as we started designing our data collection, even in 1 week, what we learned is the situation very quickly changed. It moved from people not taking it seriously enough to almost the opposite, which is they were taking it too seriously in the sense of there was hysteria based on misinformation and stories like, if somebody has symptoms, nobody wants to go near them, nobody wants to help them, right? Even in Dhaka, one person in a hospital died because she came from abroad and just had something like appendicitis, like stomach pain, that doctors wouldn't go treat her, right? And so then another aspect of the problem we have now is how do we spread good information and how do we encourage behavior change in ways that people find trustworthy, right? And then the other problem we have here is we need to not only send central directives that no more religious gatherings, people shouldn't come to the mosque, right? That's not going to work unless you get the local masjid imams, the local imams and mosques, right? Endorsing that idea and telling their constituents not to come to the mosque for Friday prayers or for other prayers, right? We need to figure out strategies to communicate with them effectively and have a trusting relationship back and forth where we understand what their concerns are, what their preferences are, and how do we get them to endorse a common message. Okay? And then one other thing that I immediately noticed is that, look, right now at that time period, so everybody was worried um, about the public health aspects of this crisis and the medical aspects, as they should have been, right? That's the first thing we learned. However, it's not hard to predict, like even 3 weeks ago, then what's going to happen is what we're seeing now, which is that there's going to be a huge economic dimension to this crisis. Um, and so we started collecting, and we need to collect information. So is it the case that in various parts of the country, some food shortages are emerging? If food supply chains are breaking down, are food prices going up in certain places, right? We need to track those things. And we need to see the government information that's coming from around the entire country. And I'll show you some ways that we're trying to do that. And the reason to do this, like, and get very detailed fine-grained data within the country across upajilas, across sub-districts or across the districts, right, is that, like in the US, we knew early on that Louisiana was in a much worse situation than Kentucky, right? But we need to have that information for different parts of Bangladesh as well. Okay? And then another aspect that people should think about and start working on is that there are specific sectors that are much more at risk. So I can tell you the answers for Bangladesh. About 87% of our export earnings come from the ready-made garment sector, right? And that immediately faces a shock. And it faces a shock because they export to the EU and the US and all the orders dried up. In fact, given the way the contracts are done, those buyers were not even paying for the orders that they had already made. Okay. So that's one sector that we have to pay special attention to. That's one of the engines of our economy. And a second sector that we have to pay a lot of attention to, our second biggest export, other than ready-made garments, is human beings, right? We have lots of migrant laborers working in richer countries in Asia as well as in Europe, including in Italy, right? So there's two aspects of the problem. So one is remittances are going to dry up, right? And we have to think carefully about what are the sub-districts and districts that are more dependent on remittance income, because that's going to have a larger economic shock, right? And on the other hand, migrants are returning. That's how the disease arrived in Bangladesh, actually, right? So you can also try to make inferences about exactly what parts of the country is the disease likely to show up in, given where the migrants come from, right? Because we do have access to databases that can tell us the addresses and the sub-district locations of migrants who go to Italy versus Saudi Arabia versus Malaysia. Right? And then finally, this targeting social beneficiary. So given all of this is a quick summary of all of the different things we're working on. So we're doing rapid data collection by phone. We started that a couple of weeks ago, right? So we're making, right now, just over 1,000 calls a day, but we've ramped up the capacity to make about 3,000 calls a day. And and here we need to collect public health information, some medical information like symptoms-based information, right? And here we're borrowing from what the doctors and the Yale Institute of Global Health tells us on how to make indirect inferences on symptoms if you only have the luxury of phone calls and not actual conversations or even medical evaluations, right? Collecting data on income shocks, food security, on the presence of migrants, have internal or international migrants recently returned to those places. Okay? And then while you're making phone calls, that's an opportunity for you to run some information campaigns as well, right? And do some social influencing, right? So here I had done work in partnership with the World Bank in Malawi, with the DIME group at the World Bank, where we've learned that in addition to or complementary to, say, the government sending out generic messages via cell phone companies and your ringtones, right? People might be more likely to change behavior and adopt policies and strategies if they receive a personal appeal from their friends and neighbors, right? And so you can devise strategies like that if you're having to make thousands of phone calls anyway, right? And you can even innovate on that, like we had in Nepal and Malawi from earlier projects in agriculture. You could send people rewards like some phone credit, right? Given that they are giving them the responsibility of spreading some messages to others, right? About mask wearing, about hand washing, or about social distancing, right? And then it's also important not only to do these personal appeals via like regular people, we can also make phone calls and try to get community leaders on board. So we immediately got a large team who volunteered to construct a database of community leaders, and we've been thinking about headmasters and imams at mosques, and we've been making phone calls to them. And here it's also important for us to coordinate with, say, the Imam Training Academy, get their endorsement, coordinate with Islamic scholars. So we have now, one member of the team put together a very beautiful script for this conversation where we pay respect to the Imam. We introduce ourselves as we're calling you because everybody respects you and listens to you, right? Here's what the Quran and Hadith says about gatherings and going to the mosque during times of crisis and what the exemptions are. And even Saudi Arabia has closed Mecca and Medina. Like, we're also trying out different variations of messaging, doing quick A/B testing to try and understand what message works well, right? So that in the following week we can adapt and also transfer over this knowledge and information to the government in case they want to scale up the most effective strategy. Because of course our implementation capacity is limited. I can only do 1,000 or so phone calls, whereas we need to make tens of thousands of calls. Yeah. And then, we're collecting some data in partnership with BIGD from like surveying managers of like McKinsey style research, so not like serious academic research in the garment sector, right? And then we have all this migration data. I'll show you some results soon. So we got all the data from the Civil Aviation Authority on the recent returnees over the last few months. We got data from the Bureau of Manpower Employment Training, BMET, another project that was coordinated with the World Bank with Ifat Sharif and Mahesh Shrestha. And we then use, like all the migrant permit data for the last 10 years, all the returnee data, etc., to try and get a sense of which are the districts that are likely, the disease is present and growing, because migration patterns will determine that. Right? And then all of this data that's coming in, like on behavioral responses, on economic responses, right? We can feed in these behaviors and economics responses into epidemiological models. Right? And as a way to connect the two features and create much more informed hotspots. And this is important because, like in the US or UK, the problem is that we are relying entirely on epidemiological models. Right? In poor countries, you can't do that because in an epidemiological model, you get a prediction on social distancing based on an assumption that, this many people will social distance, right? That might vary across income groups, like people who are not able to social distance. And all of our personal survey data that we're collecting, right, is informative about that, right? How are high versus low income folks reacting differently, right? And so we should be incorporating that behavior to sharpen our predictions. So here we're collaborating with epidemiologists, right? So somebody like Steve Luby, who is at Stanford Medical School, but was at ICDDRB for many years in Bangladesh, right? He's on the team. He's been wonderfully helpful, and his entire team of grad students have been helpful. And then we're collaborating with a Bangladeshi origin epidemiologist, Aisha Mahmood, who's at UC Berkeley, as well as with her former advisor, Caroline Bucky at Harvard. And in order to sharpen our ideas there. And then finally, targeting of social protection, right? How do we target cash transfers? in a country where we don't have that infrastructure set up. So unfortunately, unlike India, we don't have that Aadhaar system, Jan Dhan accounts, etc. Right? So in the next few weeks, we'll have to figure out how to reach the poor. So we're working on that as well. Okay, so that's a summary, and now let me just quickly show you some results. So the phone surveys, we ended up using like convenience samples in the following sense, that there were these samples where I was collecting data for the last couple of years, where the value is that we understand the statistical representativeness of those samples as well as the statistical adjustments I need to make in order to say representative things. Okay, so that was important. That's why the sampling frame that we already had was important. Second, we prioritized projects where we had good geographical coverage across the country, because like part of what we want to do here is cover the entire country with information so that we can, properly allocate resources in one area versus another. Okay? And then we also are collecting data on especially vulnerable populations. Like we have large projects going on in the Rohingya refugee areas, right? So the first set of calls we made, the first 1,000 calls, were to both the refugee communities as well as in the camps, as well as members of the host communities who surround those camps. Okay? And then we are trying to we are also making phone calls to, especially vulnerable populations as part of like social transfer programs, right? And as well as seasonal migrant workers in Bangladesh and in Nepal. And the reason for seasonal migrant workers is that you worry about them carrying the disease from one place to another, right? So based on all these different pieces of information, the hope is that we can triangulate and inform epidemiological models much better, because these migrant workers will give us a different type of information about mobility from where do people move in these particular months, versus the other populations will give us much better information on what's happening in and around districts. Okay? And then to build, so I'll show you the picture. So basically, from my own samples, I'm able to cover these parts of the country. Right? I have a lot of white spots still, right? That's the problem. So this is like across 3 different projects. These are the places where we've been collecting data. This is the Ubudilla level map, sub-district. Now, what I'm trying to do is collaborate with the telecom companies to get me representative samples of people from all districts, like a random set of phone numbers. And for that, we need to get special government permission. So we have joint calls between the government and the telcos and us, explaining what is it that we're trying to do and why the joint collaboration would be helpful. Okay. And so we have data on symptoms. So what do we do there? I talked to the Yale Institute of Global Health as well as the Yale Health Plan. So 3 weeks ago, they themselves were struggling with, okay, how do we identify new haven cases when we don't have testing, right? So they came up with an algorithm that here are the symptoms that positively predict COVID versus others that negatively predict COVID that are good news, things like ear pain or nasal congestion. So we asked those series of questions to make an indirect inference about the symptom prevalence. We're asking about social distancing behavior, there were awareness, and because we collected data, we're collecting these data from these pre-existing samples, we have a lot of baseline information. So that way, with the awareness, we can match it to their baseline socioeconomic conditions and many other characteristics. We have detailed like 3-hour survey data from these guys, right? And on economic impacts. Okay? And the behavior change messaging, as I said, we're doing some household level social influencing. We're also doing community level social influence in partnership with the government, A2I, with BRAC, Youth Policy Forum. And this was the amazing thing. I asked like young professionals in Bangladesh, I'm just connected to those networks, that, okay, we need to make these phone calls. I can't get my enumerators to send these phone calls. If I have to call the imam, I need somebody who is at a much higher level of education, who can show the proper respect. Immediately we asked, and we got close to 100 people volunteering to make those calls. Right? And that way you can like cover 1,000 imams in a couple of days, because we are doing like 15-20 minute calls. And just the amazing amount of talent and interest that people have in Bangladesh to help here has just been fabulous to see. Okay, and then in terms of predicting coronavirus hotspots, I already gave you a hint that we can use migration data for this, right? And let me show you what that produces. Okay? So this is the colors in this map. This is district level, this is sub-district level. The colors in this map, the darker colors tell you that these are the districts that are more dependent on migration to coronavirus affected countries, right? So for example, a lot of the Italian migrants to Italy come from this region of the country. That's why the colors get darker here. Okay? So now that gives us like an indirect prediction on, okay, if the coronavirus was appearing on the basis of migrants returning to Bangladesh from other corona-affected countries, where are the likely places that they're showing up? And then these black circles are basically, we're also trying to validate our exposure, risk exposure measure on the basis of like whatever quarantine data, testing data that we have, right? We have very limited data there. And then the goal here is then to also merge this with our symptoms data, because then we can have multiple points of validation. And hopefully we take all of these different data sources from so this is based on returnees. And then we also have data from the government on the distress calls they've been receiving. So instead of a 411 number, we have a 333 number that's been repurposed to get calls. So we can see exactly where those calls are coming from. Right? We're protecting privacy. We're just getting from the telecom companies, we're just getting sub-district level averages. Okay? And so we can basically use these different sources to try and triangulate where we're likely to see the highest prevalence. Okay. And then just to give you a sense of, does this validate well, right? So I realized that when we were doing this in Bangladesh, why only do it in Bangladesh? You can do this for the entire world, because we also know migration links from the United Nations, from one country, bilateral migration links between countries, right? And so this is on the x-axis. I've basically given migration links. What I'm plotting is on the x-axis, every country's exposure to the international COVID crisis. So basically, countries like India will be high up, right? And the reason is India supplies a lot of migrants to countries, including corona-affected ones, right? Mexico is high up, and it became high later because it's connected well to the United States. Yeah? Whereas on the y-axis, to validate this, I have the actual cases that have been reported around the world, right? Of course, this is also being imperfectly measured because we don't have universal testing. Okay? So then but this is what how it lines up. So we basically just based on migration exposure, you can explain about 48% of the variation in actual cases. Okay? So this is how it lines up internationally. And then you can also, like the same thing that I did in Bangladesh, you can do it for any other country where you have subnational data, right? So we should be doing this everywhere. If people like the idea, that is. So this is for the Philippines. We just happened to, thanks to Dean Yang and his collaborator Caroline Tiarides, we were able to get subnational data on migrant supplies from different provinces and different counties in the Philippines, and you can create an indicator for that as well. And then in the international level, right, like it looks like our validation, this is for Eastern Europe, right? So the darker colors are the migration exposure to, say, mostly to Western Europe. And then the size of the circle is the actual number of cases. And this, and this is one place. The reason we use Eastern Europe is that this is one place where we, it was only both a migrant sending area and it had a lot of testing done. Right? And the validation looks pretty good there. And then you can then apply this to other parts of the world. This is for South America. This is for Africa, etc. Okay? And then let me now, I put this slide in here because I wanted to tell you about, by the way, Carolina, how are you doing on time? Oh, you're on mute.
There's this double mute system. Sorry, I think we are fine. You have a couple more minutes.
Okay. And then, so let me tell you in a couple of minutes, a couple of quick things. So one is data is also useful for not doing things. And, evidence-based policy means not only that you do things on the basis of evidence, but you stop doing things on the basis of evidence, right? So we put together a coalition, and I had a commitment from a funder or a soft commitment from a funder, right, for several $100,000, because based on collaboration with medical researchers, we decided that masks are a very high return investment. Okay, and that's absolutely true. Masks are very, very high return. It can save lives at very, very low cost. Okay, so we worked with the garment factories in Bangladesh who are idle and said, okay, let's try and quickly produce a large number of masks, right? And with Steve Luby's team, we were able to figure out, given the materials available in Bangladesh, like the cotton materials, what is the mask design, right? So we did all of this, and then last night I pulled the plug. Okay? Why did we pull the plug? Because what we learned over the past few weeks in Nepal and in Bangladesh, this is the data that's coming, like as I said, we're collecting data all the time, right? This is what's happening to mask wearing in Nepal and in Bangladesh. right? So it turns out that that message of like everybody should be putting masks on, right? That is getting through, right? And I worried about like social desirability bias. Is it the case that people are just reporting, yes, I'm wearing a mask when they're really not? So I also asked the question in the form of, when you go out, or do you see other people wearing masks, separately from you? So 97% of people in Bangladesh now say, around Bangladesh, from our survey data, say that they are wearing masks, and they also say that 80% of people or other people are. Okay. And then finally, let me show you something else that comes out of the data quickly. Okay. So this is survey data from Nepal, and the value of doing these post-lockdown surveys in samples that we already had been following around since September last year, right? This is numbers from September, October, November, December, January. You see, this is the variation that you see depending on the agricultural season on the number of hours worked. Okay? And then we've made the phone calls recently, right after the lockdown. Look where it goes. Okay? So this is like the agricultural lean season, when there's less work. Even, and that's called the hungry season in Africa, in Southern Africa, Sudur in West Africa, right? Monga in Bangladesh. So relative to that, this is how much lower it is, right? So I was extremely worried about this. But on the other hand, their food insecurity is actually not, it's not as, it is bad, but it's not as bad as the hungry season. Right? And that's where we got lucky, which is, it just so happened that the COVID crisis hit and then lockdown hit during the wheat harvest. So a lot of people still have some grain stock. Right? But this data teaches us a lot, in that while people are still eating right now, right, this is not going to last. Right? And we can make predictions on exactly when this will run out, because we can make predictions on when the wheat harvest might run out. Okay? And this is data from the Western Terai of Nepal. Okay, but people are extremely worried about food. So this is like, if you look at worried about food, because this is a question we've been asking every month since we've been tracking them. So their worries about food look comparable to the lean agricultural lean season, the pre-harvest lean season, before the rice harvest, and that's where we are. And then now, if you look at top concerns of households, okay, what in Nepal people are reporting to us is that they're not so much concerned about coronavirus health and safety. In fact, when I look at the response to coronavirus specifically, people think of it as low risk. What they are really concerned about right now is food security and unemployment. People are skipping meals. Okay. Oh, sorry. One final thing, and I'll stop. I promise. Okay. This is it. So how do we do social benefit transfer? Okay. So we have a large team now working on this. So in Bangladesh, we have a limited infrastructure situation. So one way to do the social benefit transfer is that you could try and get lists from different parts of the country, have the politicians or the bureaucrat create those lists, right? And then send people money on the basis of who shows up in those lists, right? And in the immediate term, the money that goes out this month, we probably have to do that, right? But here's another strategy that we're trying out. So you could use some machine learning in the following way. So remember that I have these survey data for like 15,000 households around the country, right? So that means, and different types of households as well. So that means that, from the survey data, because these were detailed surveys, I have like the ground truth of who's poor, who should be targeted, who's deserving, who are the migrant laborers, the occupations, because I have occupation, etc. Okay, so we have all the information from the survey data. So based on that, you could target the 15,000. That's only 15,000, but what about the other 150 million? Okay? So what you can do is, like, we also have the cell phone numbers for that sample of 15,000. So you can merge the cell phone numbers and cell phone usage data with the 15,000 household survey data, as long as you form a partnership with the mobile phone company, right? And then you can look at how the cell phone usage patterns differ between the people who are poor and deserving versus not. Can you distinguish the poor versus the non-poor on the basis of patterns in their cell phone usage records? It won't surprise you to learn that compared to you and me, people's top-up behavior, how much data they use, what type of cell phones they use, etc., are different, right? And the reason we are using this type of a strategy is that the government, BRAC, me, nobody has this kind of information for 150 million. The one technology that people use, and Bangladesh has about over 90% cell phone penetration now, right? The one technology for which we have massive amounts of data is cell phone technology, right? So that's why we're trying this out, where we're doing machine learning in order to map cell phone usage data with household survey data, you can, out of the 15,000, maybe use 9,000 of those, and you have a 6,000 holdout sample. And you can test your model on the holdout sample. How well are we doing in the holdout sample in predicting who's poor or who should be targeted? We're also working with the government to identify who should be targeted, right? Which is it just the poor, or it should be the people who have been most economically affected during this crisis? And should it be people whose livelihoods depend on mobility because they impose the largest external public health external by spreading disease? Okay? So once we identify that, we train the model, right? If you have an algorithm we believe in and it tests well, then you can turn that algorithm over to the cell phone companies and tell them, for the entire population of 150 million phone numbers, tell us which ones satisfy this criteria. And you might not want to just rely on a machine because there'll be inclusion errors, there'll be exclusion errors, right? But you want to combine efforts. So then you get these numbers, and then our algorithm tells us here are high likelihood people, here are middle likelihood people, okay? Then you could send them an SMS and ask them a few questions to do some self-targeting. Right? Answer these 3 questions for me to identify whether or not you are somebody who's deserving of support first. Okay, I'll stop. Sorry if I went over.
Thank you very much. This was a lot of food for thought, and I really like the balance between, some big picture ideas at the beginning of your presentation, but then a lot of sort of very practical suggestions and ideas as well as to what can be done with the data that we have. So I very much appreciate that. Let me go to Benu and ask her to, react to some of what you said, and hopefully also share some of the work that her team is doing in Bangladesh and other countries in the South Asia region. Benu, over to you. I think you're muted.
Thanks. Can you hear me now?
Yes.
Okay, perfect. So thank you very much. That was a fascinating conversation, and very impressive how quickly you've leveraged your networks, both within the academic community, but also in Bangladesh, and the sort of knowledge that you have to be able to provide evidence very quickly. And I think maybe I'll end with that a little bit too, in the sense that clearly that having that has been a huge plus, the infrastructure in a sense. Starting from scratch is much more difficult. So maybe I had a couple of thoughts on if we could, in the 3 areas. One, you talked about the model and the need to improve it, and the second is really your slide on when you talked about the way forward. And then third on designing policies, but also really about the whole data agenda and how important monitoring and being able to adapt is so critical when you're flying blind in a sense. Okay, so the first on the model, and I read what you had written before, and I know you I hope you do get the code so that you can modify these models to be able to better do predictions in developing countries. And one of the points you make is that, perhaps there's an underestimate of mortality because there's a higher burden of infectious disease and chronic illness in low-income countries, which, it would be important to model. I had sort of a couple of questions on this issue of the model. One, it seems to be driven by, the characteristics of these economies are different, and the cost and benefit, I agree, is different. The age structure, the informality, higher poverty is all true. The one question I have is really about density. These countries are so much more dense than the developed world in many ways, right? New York City, which is very dense for the US, I read somewhere 27,000 people per square mile, and in some slums it's 800,000. Okay, so how does this fit into it? Because I do imagine that this makes both the distancing difficult, but also that exposure may be higher. I don't know if dosage matters. So that's one question on the model, and whether that's something that is possible to adapt and whether you think it matters. And then the second is really also the policy responses, in the sense of, these mass movements of migrants across the country. You saw in India, the lockdown was announced with no time for people to move. And when you have a structure where you have informal workers, then and no jobs, this is destitution. So what does that mean? And could one actually even think of the future of, even if you do smart lockdowns, how it's done? Because this is probably an unintended consequence with higher implications for the spread of infection and mortality. So, so that's on the model. The second is on the way forward. There were two that I would particularly like to pick on and or push on. One is this notion of containment in a smarter way, or is it realistic? Does it happen? And how do you do it? So you allow the younger to work and isolate the elderly. I mean, we've said that too, based on what you've said and many others, and makes sense. I think the question is that we are being asked, and it's a valid one, is this realistic and possible to do, and what would it take? Because, I mean, think of the slums and multi-generational households, and so how realistic is this? It's a question. And what is your experience if you have used behavioral interventions and or community leaders to do this? That was the first. And the second is really, I think, this question of getting the money out quickly, which you partially answered at the end with the phone point and what you're doing with the machine learning. I think that's very interesting. Sort of getting the money out quickly in this crisis. I mean, should we care so much about how we target? Of course, the countries do have fiscal constraints, so they do need to. But how do you do it when you do not have safety net systems, and that the people who are likely to be affected may be those in informal sectors, household enterprises? How do you reach them? I think the cell phone idea is one that we've certainly all been thinking about. I think the other one you mentioned also is geographic targeting, to the extent that given our existing knowledge, we do know maybe where people who work as migrants come from and where the links are the strongest. So I think just a question on that, really on I think more people would be interested in following this work and doing it. On the designing of the policies, you did say that testing is not an option. I sort of see it in the short term. But if there are tests that are developed, given the evolution of this crisis and how it is playing out, is this something that becomes more realistic over time? If low-cost things are developed, and then it may make a lot more of this isolation and distancing doable. So it's a question about whether you think that this is just a short-term thing or a long-term thing too, or longer, more medium-term. The second thing that I found fascinating is the whole behavioral change about message and trusted messages and using the community leaders. And I think learning about that would be great. And as you develop this work, I think, having, you can use the phone surveys to do it for both individuals, households, but also firms and community leaders and sort of key informants in a way. And maybe my final point is this issue around data, and a lot of what you shared. First is really using existing data. I think. and having what you have with this sort of research network in Bangladesh is hugely important. And I know we are collaborating with you on the Cox's Bazar work, and are also, the survey, another survey will be going soon there. So we're leveraging that, but also leveraging other surveys we have in Dhaka and Chittagong to get a sense of what's happening in the urban areas such as the slums. So I think that makes a huge amount of sense. And in other countries we have other surveys we are leveraging in India, in Pakistan. So that's definitely makes a lot of sense. The second is this question which you raised of building representative samples, and really, the need for collaboration with telecoms, trying to access data. And I think this is an issue anybody who's trying to do research faces. Is there a way for us to think about democratizing this in a sense so that this data is available, so that governments get the best advice out to countries, can get the best advice, and done in a way that respects privacy? And I'd like to sort of get your thoughts on that, because at the end it seems to be about who has access, who can get permission. In India, we're trying to do it too, to get data from telecom companies, also just to understand the migration and movements of population, which gives you a sense of where need may be, and how you target geographically. So your thoughts on how some of this could be a public good, but I don't know if it's an easy way to do while respecting privacy, and how one does this. The second is on the data. Of course, you mentioned you've been amazed by the talent and innovation that is possible within the country. And really, I think the use of big data, whether it's geospatial data, migration data, phone data, I think there's a lot more scope to use this, and we are doing some of this using different ways through Facebook, Google. I think there are collaboratives that the bank has set up, so we can look at population movements, etc. So this, I think, is great, but I would like to hear a little bit of what you think on how this can be a public good so that the advice is better. And then thinking more forward, really the crisis is an opportunity. And so it's a real, it's a time that there's a huge crisis, a huge need for data. And it's also a point where I think governments can be shown the value of this, and really the value of modernizing their systems so that they don't only rely on surveys, but it's better admin data, better integration of data, as well as I think the striking partnerships with the private sector to actually be able to access data that can help improve the quality of even things like national accounts. I think price data in India, there's work where we're trying to see if this could happen with Nielsen data, because price data collection wasn't possible during the month of April. So that's one thing. And then I think substantively, really about.
Venu, I'm going to ask you to wrap up in a minute or so, because we have lots of questions that we have to.
Sorry, I'll stop. It's about safety nets and urban areas and how the systems need to be improved for the future. So thank you very much. Fascinating. And I hope we can collaborate and continue to work together in Bangladesh and other countries and Nepal.
Thank you, Benu, for excellent remarks. I'm going to propose the following. There are lots of questions that have come through. So what I've tried to do is group them in 3 broad topics. So there are a set of questions around modeling, particularly on the first part of the presentation. Then there are a set of questions on the policy response that you propose and other, policies to be considered. And then there are a set of questions on the high frequency data, how to use it and so on. And I think this also captures some of the comments that Benu made. So what I'm going to suggest is that we go about this in 3 blocks around those 3 sets of issues. And what I'm going to do is call on a few people per block that are sort of representative agents for a lot of others that ask, similar questions. So hopefully, everybody sees their question covering one way or another. So let me start with the questions on model, and then I'll come back to you then, once we have 2 or 3 under each block. So let me start with the questions on modeling. I think Benu raised these and a lot of others did. And I think the gist of the first question is how, if at all, does your work, the work you presented, take into account sort of the impacts of things like poverty, malnutrition, pollution, which are much more prevalent in developing countries, the impact of that on health status and risks. So that's sort of a set of questions along those lines. And then I'm going to ask David Newhouse to ask a question that he and many others had on again, what are the assumptions on the strength of existing health systems and capabilities of health systems? So David, if you want to come in and very briefly ask that question, and then we go back to Professor Mushfiq on this.
Sure, thank you, Carolina. Hello, Mushfiq, thank you for the fascinating presentation. My question was on a couple of aspects of the question of the trade-offs between social distancing in low-income countries and high-income countries. One is about the capability of the health systems. If the health systems are weaker in low-income countries, does that strengthen or weaken the case for social distancing? One could argue that it strengthens the case for social distancing because there's less benefit from keeping the health systems underwhelmed and licked compared to the high-income countries. The other question I had was about the extent to which the models and the calculus on the cost-benefit of social distancing accounts for the possibility of developments in treatment, for example, for antiretrovirals that may occur in the next couple months. Thank you.
Thanks, David. So let me go back to you on those broad questions on the modeling. Thanks. I think you're muted. Mushfiq, I think you're muted. We can't hear you. There's like a double muting system, so you need to unmute yourself on the system and your computer.
Oh, I see.
Now you're fine. Great.
Okay, somebody help me unmute. Because I'm sharing screen, I think it's harder for me to find this. Maybe I'll try
Now you're fine. We can hear you.
It's just, no, what I was saying is somebody help me unmute just now.
Okay.
So I'm gonna stop sharing screen because then I can actually see the unmute button. Okay, excellent question, David, and combined with the questions from Benu on the same lines on modeling. So there are 2 questions. The one, as David pointed out, on health system capacity. And turns out in this model, it can cut both ways. In fact, if you're really worried about health system capacity, here's how the model works. Okay, so remember why we practice social distancing was because we want to flatten the curve. We want to flatten the curve below the health system capacity. Okay? And so if you delay infections in a rich country, it doesn't get overwhelmed. We don't get the excess mortality that comes from the health system not caring for the sick. Okay? Now, if your health system capacity, right, is not here, if it's down here, right, then flattening the curve and delaying infections does not produce much extra benefit. So it actually, the primary effect of health system capacity in like hospital beds or ventilators, it probably would go in the other direction. We should be less of a proponent in poor countries for distancing. But on the other hand, everybody is absolutely right. I'm sure there are multiple questions. This is something that I've thought about from day one, and we write about not only in the paper, but also in the foreign policy article in the media. I always mention this, that nobody has good information on the comorbidities. Okay, and so Nicholas Kristof today actually wrote a op-ed that makes the exact same point we make, which is great. But then he points out, he makes this opposite point, which is, oh, the obesity rates in the US is so large, right, compared to other countries. It might be that the comorbidities in the US are actually even larger than it is in poor countries. Who knows, right? But on the other hand, we also have a little bit of data now that suggests that people who are more exposed to pollution, COVID is more fatal, right? And there, I immediately jump back to my research from many years ago on indoor air pollution exposure, right? In developing countries, it's extremely high, right? So if pollution is an important comorbidity, we should worry about that a lot. And so the problem is that, look, these comorbidity numbers, I need public health researchers to tell me what they are, right? So what if we can't get these numbers in the next version of the model, we will make stuff up. Sorry, not literally, but we will study maybe sensitivity of changes in those assumptions, okay, based on maybe the pollution study. Yeah, so excellent questions. It's on our radar. Okay. Oh, you're on mute now.
Thank you. Let's remind each other. We're moving on to the next bucket, and actually there were lots of questions on this, on the policy response and how to think about that. So I'll take a few of those. So Bennu already asked about how to think of income support and safety nets, particularly in urban areas where we may not have existing systems, right? So that I want to put that back on the radar. I'm going to ask Alfredo to come in because I thought he had an interesting question, which is a little bit more high level on whether there's actually a consensus emerging on this issue of the approach having to be different for these countries. So Alfredo, do you want to please ask your question on that?
Yes, thanks, Carolina, and I hope my connection holds up. Yeah, so the question is there, while we saw a sort of initial knee-jerk reaction to sort of as a way of imitating developing countries would impose lockdown or very severe social distancing measures, is there now a different consensus evolving in the sort of nexus between economics and epidemiology that you clearly navigate on whether actually developing countries should take a different tack along the lines of what you're saying? What is the mood music, basically?
Okay, so my understanding of the mood is here I'll tell you about a tweet from the Center for Global Development. So they tweeted out the foreign policy article we wrote with the tweet saying what here Mushfiq and Zach are laying out what appears to be the emerging consensus. Right. So the CGD who's taking that pulse seems to suggest that a lot of people are feeling this way. And here I actually want to make a point about politics. Okay? So, and now that I've read the article, I've now connected with leaders in a number of African countries as well, who reached out to discuss, what they should be doing. Luckily, they're a few weeks behind us in terms of virus reaching, so they have some time to think about this and strategize. And here, what I want to point out, something I'm learning is that, look, it's very difficult for politicians to make decisions that appear to be different than what Europe and the US are doing, right? Because basically any decision you make here is absolutely true. And anything, that's why I said at the outset, I'm unsure about things. Anything I propose will cost lives, right? Will cause hardship. And now if a politician makes those decisions, it's really difficult for them, right? So part of the reason that we're trying to get things out very quickly and write and talk about this, and this is also why it's important for us to have this discussion here, is that we, not politicians, also need to provide some political cover to allow the decision maker to make some brave decisions that's the right one for their country. Right? And let me just segue that into a question that Bennu raised about how do we form coalitions and cell phone companies, etc. And there's a lot of politics there too, right? So I just want to make a general politics point here. So when I'm having these conversations with cell phone providers, right, it is important for me to understand what their objective function is and what they care about. I'm a researcher. I can just go after what I'm interested in, which is I need to design a benefit transfer system. But they're also responsive to their shareholders, right? They're in a competitive environment with respect to each other. right? I mean, to have a good understanding of what is it that they need to collaborate well and give us the time and give us the technical support and their computation time. So strangely, like in the work that I've been doing for the past 3 weeks, I'm excited about modeling, I'm excited about data, right? But a lot of the time I'm spending is like navigating, for lack of a better word, politics, right? Navigating people's interests.
Thanks for reminding us about that. I can certainly sympathize with that. So let me go back to picking up some of these policy questions. So there was the safety net. We'll come back to that. I'm going to ask Rina. She and others had a question about how to think policy response in the context of multi-generational households. Rina, do you want to talk briefly about that, please? If you're talking, okay, so maybe I can ask the question for her and others. So there were questions around how to think of, in a way, what you're proposing in the context of households that are multi-generational and where you have high risk and low risks population combined. And I suspect that this is going to go back to the communication and behaviors, but maybe you can tell us a little bit more about that. And then the last sort of set of questions were around testing. You seemed somewhat skeptical about the potential for testing to be a powerful tool. And there was sort of a pretty active discussion on the chat about that. So can you tell us a little bit more about your skepticism? Is this because of capacity? Is this because of cost? What explains that? And do you see that changing, say, outside the Bangladesh context? Thank you.
Sure. So on the multi-generational households first, because that also connects with the point that Benu had made about, is it realistic for us to impose social distancing in, say, in a place like India, where there are multi-generational households? Can you effectively protect the elderly, right? Now, Debraj Ray has written a book eloquently about this, and his point was, look, we do need to have different types of institutions cooperating here, and that we might need to outsource the responsibility to protect the elderly or protect vulnerable members of each household to families, right? So what that means is that, okay, we should have guidelines, but like the government shouldn't try to solve every single problem, right? We should have guidelines on, okay, look, for economic purposes, if you're hungry, you need to go out, you can go out. When you go out, definitely wear masks, right? Because as Ben also pointed out, viral loads actually matter a lot, right? For fatality conditional on contracting the disease. So do it in safe ways, maintain distancing where possible, right? And then try to protect, your family has to make a decision. You have to clearly inform them, these are the vulnerable groups, because this is how the disease behaves. And the family has to figure out how to do this, right? And of course, it's hard in urban slums. Of course, it's difficult in multi-generational households. But I think the alternative is even harder, right? And then on testing, okay, the very quick answer is, look, I was talking about testing in terms of that not being a viable solution in Bangladesh for the next few weeks, which is why I jumped to all the strategies we're pursuing, right? And so you could, and here's the problem in Bangladesh. I know it's not just about test available, right? It's also about the testing infrastructure, depending on the specific details of the test, right? And then out in remote rural areas, decentralized around the country, we don't have that strong an infrastructure to process tests, even if tests were to become available. Okay? And I should say Bangladesh has had an impressive history, thanks to our very impressive NGOs that have a footprint around the country, that we've been able to get out other types of messaging, like oral rehydration therapy, right, or the local substitutes for it. Right? RAC, back in the late 1970s, personally the organization visited like 10 million households. Right? It did seem to make a effect on on reducing diarrheal disease mortality. So again, back to the early in the presentation, I talked about frugal innovations. We have to think about context frugal innovations. Now, I really don't know when testing will become available, so I shouldn't comment on that. But like waiting for a vaccine, that might be way too long, right? Given the agricultural seasons, right? So let me tell you about the big problem that I'm worried about in Bangladesh now. The government's worried about the Boro rice harvest, the second rice harvest that is about to come online. And now people, because of hysteria and worry, right, landowners are reporting that they can't find anybody to do the harvest work. So even though Bangladesh has experienced sharp drops, like 75% drops in our data, in BRAC's data, in rural areas, in like income earning opportunities, people still aren't coming out because they're really scared, right? They think that Kiamat is coming. I don't know what the second coming. I don't know what the English word for it is. Okay, and so we need to figure out how is it that, like, if we can't get the Boro rice harvested, then we're gonna have a famine, right? Our food supply systems is gonna break down, right? So we need to come up with smarter strategies that we need to address, like this week and next week, and that's why I'm just not thinking about testing.
Thank you. I'm going to move to the third bucket. There were a lot of questions on the issue of high frequency monitoring and then how to use that data, right, once you have it. So I'm going to start with Hassan, who had a question, sort of, I guess, a big picture question on this. So Hassan, do you want to come in?
Sure. So first of all, Mushfiq, many thanks for doing this work. I think as a fellow Bangladeshi citizen, I think we really appreciate the fact that you're spending your valuable academic time to think about such practical things and things that can really make a big difference in real time. So thanks for a start. And let me just sort of probe you a little bit on terms of this emerging consensus issue that you very eloquently raised in your foreign policy article, which has been influential. I've seen it reprinted in South Africa and elsewhere. And the thing is that I don't quite see it making a lot of headway right now amongst the political elite who are making these decisions on the lockdown. So it's not clear to me, at least, what the timeline for phasing out these lockdowns are in Bangladesh, or whether it's in the Philippines, for instance, since I now work in East Asia. So there seems to be, an emerging consensus, but not clearly amongst people who are going to make those decisions right now. So do you think it's just going to be that, well, we're going to have to see social unrest on the streets before these things are phased out? What is it that's going to trigger change? But let's assume sooner or later that change is going to happen. So I guess my specific question is, can we then translate some of your very valuable real-time monitoring and insights into the fact that this lockdown strategy doesn't make as much sense as in the West, to talking about the next phase of phasing in, the economy. So whether it's agriculture first, for instance, as you just alluded to with the Boro harvest point, or should it be the garments factories getting going and using some form of social distancing there? And if that's say something that you want to think about and propose, I can also share with you some examples from Indonesia where actually they have tried to introduce some of that social distancing within garments factories as well. But more in general, if you have any points about how to really get the emerging consensus into our political circles and how to build those coalitions, it would be helpful, and we'd definitely be very happy to be part of that. Thank you, Mushfiq.
Why don't you take that, because I think that's relatively sort of complex in itself, and then we'll take a couple more that are more on specific aspects of the high frequency exercise.
Okay, thank you, Hassan, for the kind comments, and I hope academic time and actual helpful time in the world are not at odds with each other. So on the time, let me talk about the timeline process for phasing down the lockdowns. Right? It is, and I wanted to connect it to the points you were raising about high frequency data. Right? So we do have to think carefully about that right now. Like each country has to think about it independently about like what are the sectors that we prioritize, right? Should we be prioritizing export-oriented sectors, or how do we make those decisions? And for that, we actually need a lot of thinkers on board. Right? I can bring data, and I've been focused on data and evaluation based on, what I know how I do things, right? But this is a case where I think macro policy thinking, right? And not just like relying, going back to how we do things in order to publish in top journals. That's how we, So what my plan right now is that, and we've already started working on this, the government, is to convene some of the key thinkers who understand the country, who understand the different sectors, right? But who also represent the different sectors, right? To come up with a plan that we present to the government. I would really welcome, exactly you and others like you to participate in that process. Right? And you probably are connected with a lot of the other people we need to bring to the table. And then in terms of, there are some things that, and in terms of the conversations that I'm having with some decision makers in a few African countries, right, that there are some things that people believe that they're not able to say out loud. Right? Because it's, me saying it is one thing, a politician saying the exact same thing is totally different, right? So I think a lot of the influence that has to happen, right? Or at least not influence, I shouldn't use that word, I should say prodding to think carefully and in a sophisticated way about both benefits and costs, right? It has to happen it has to happen publicly, partly, so somebody can be blamed, right? But it also has to happen privately, right? And we're trying to, so hopefully we'll see in the next couple of weeks, right? We'll have a few more conversations about this, and that people who are a lot more influential than me, right? Hopefully we'll be able to anchor those conversations. But absolutely valuable point. And I think the next step for us is we need to start planning on the macro side as to what the policy strategy would be. When I say macro, I don't mean like macroeconomics. I mean countrywide policies on like what sector by sector. How do we phase this out? Thank you.
Thank you. Let me ask Ambar to ask a question that he had on how to use some of these the phones and the data that they generate for targeting. I think I think others were able to learn a little bit more about what you thought on that. Ambar, can you come in?
Yeah, can you hear me? Okay. Hi, Mushfiq. How are you? Thanks. Great seeing you on the video, if not in person. So a couple of questions. One is actually a very quick follow-up to the sort of the political discussion that we're just having, which is that do you think the WHO, well, international organizations, and especially the WHO, which is kind of an authority on these recommendations, do you think they have a role to play in making it more acceptable for politicians to take a more nuanced position? I mean, that's and that's, it seems like that's one thing that we can or academics can possibly influence. And of course, there are much more sort of complex politics going on, which we have no influence over. The other, the actual question that I had is to do with this use of it seems potentially very useful to use mobile phone usage patterns and use that for targeting, right? But I would be somewhat uncomfortable using it for sort of individual level targeting, but I would be more comfortable sort of using it for, let's say, community level targeting to identify places or localities where there are more poor people and so on. So is that the way you're thinking about it? Or I think it's fine to even use it for individual level targeting. And related to that, would you be concerned that these patterns of usage could actually change a lot in response to a shock as deep as COVID-19, in the sense that maybe there were differences in patterns that you could identify based on what we know on past research between the poor and the non-poor, but is that changing? I mean, could that cause problems in terms of drawing these inferences? But I did think it's a very sound and practical idea, certainly for community level targeting. But just wanted to hear a little bit more from you on that. Thanks.
Back to you.
So yes, three questions there. So one is the WHO. Absolutely, they have a huge role to play already in conversations. WHO guidelines, etc., comes up all the time. Even the messaging that we are doing, right, in our social influence campaigns, we have to pay attention to the WHO guidelines. And there we and in some ways the WHO, for example, their guidelines are maintaining distance, right? Whereas when I talk to like a environmental engineer who's been studying the details of exactly how the virus travels, right? It turns out that his guidelines would be a lot more stringent even than the WHO guidelines. Okay? But on the other hand, the WHO is also doing strange things like mask wearing is not part of their guidelines. And why would that be given how cheap masks are? So there's a worry, completely unfounded. I mean, because I know that I've now gotten deep into this literature with co-authors, completely unfounded worry that as soon as people wear masks, it might not be protected because we haven't had a randomized control trial done yet, right? And so the FDA or the CDC has not yet approved mask wearing as a medical intervention, right? And so what if, okay, since we don't have that data, now you have to worry about, okay, what if people become complacent with masks and they think that it's more protective than it really is? And then there's like some kind of a rebound effect, right? They engage in behaviors that are not so safe, right? But the thing is that just because we don't have a RCT-based evidence that masks are amazing medical inventions, right? It doesn't mean that we should not be incorporating mask wearing. I mean, like, given the existing evidence that we do have, which is non-RCT and some lab studies, right? I think it really should be part of the toolkit. So those are specific ways in which academics are trying to put pressure on the WHO, and we need to keep that pressure. And this, the mask RCT that I just dropped in Bangladesh, right? The good news about it is that it's because everybody's wearing masks anyways. That's why I don't want to waste money doing an RCT, right? But the sad news of dropping it is that it would have been an RCT that hopefully, I mean, we already had set it up so that we'd be able to show, if it's true, that there's an absence of this kind of rebound effect, right? We had a plan with the cell phone companies, etc., to collect data to demonstrate that. So that's a specific example of where the WHO can come in. But general, yes. Number two, on individual versus community level targeting. Look, I do think we need to do some individual level targeting on this basis, right? But don't think of it as okay, a machine tells us this person should be targeted, and immediately money goes to them, right? There has to be other checks put in place. So the reason for the individual is, let me first make the case for why I think individual and not community, right? Although you can do both, of course. Why individual in addition to community, let's say. It's because within, like, in urban areas, maybe you go to a basti, like a urban slum, right? You can just do simple geographic targeting there, right? In rural area, we have a much more complicated, complex problem to solve. We can't just simply look at like a community or a geographic location. Okay? And so think about, like, if you want to target not just on the basis of poverty, but like people who are mobile, who might spread disease, right? We do need to identify within a community who are the migrant laborers who are frequently migrating. And cell phone data is fantastic for that, right? Because the cell phone can pick up which tower, like within the course of the year across different months, which tower are you pinging to, right? Even if you don't have a smartphone with GPS on it. So that's a way in which we can target specific groups, right? Because it turns out some occupations have different cell phone pattern uses than other occupations, even within a community. Right? And then finally, your point about, that's basically the Lucas critique, right? But the public health version of it, which is as soon as you implement some policy, people will react exactly to that policy. And so what we are doing here is getting data from the last, since our in-person surveys were done till today, that's the kind of data we requested. So the training the model is kind of backward looking, right? But I agree with you that if you were to repeat this process going forward, right, then we'd have to think carefully about what adaptation has already occurred, right, in order to make people more likely that they would receive something.
Thank you. Unfortunately, we ran out of time, even though I'm sure there are still lots of questions that were unanswered. So I just want to share a couple of things before we close. We are actually undergoing surveys to the one that you have been doing in Bangladesh and other countries, meaning using phones to reach out frequently to households, and we have colleagues who are doing the same thing on the firm side. And we have about 80 of those now at different levels of planning and implementation. So happy to connect you to the teams that overlap with some of the countries that you alluded to. And I just wanted to share that with all those connected, because there's been a lot of questions about, can we generate more of this data and how to use it? So there's work ongoing to do so. And thank you very much again, because I think you've given us a lot of thought, a lot of food for thought in terms of how we can use that data once we have it to support the policy response and to engage with policymakers on the lines that Hassan mentioned to make the case for maybe a slightly different approach. So let me stop there. Thanks again. We'll be in contact, I hope, and best of luck with the fantastic work that you're doing in Bangladesh. Very inspiring. Thank you, everybody, for joining.